Now we will move to menstrual problems. This is really not a menstrual case, but we had to put it somewhere in the notes. This is really a premenarchal vaginal bleeding, which is not hormonally related probably at all. The case is an 8-year-old girl who was brought by her mother to the office because of vaginal bleeding for 2 weeks. She has not taken any medication. Now, why is that important? If she was taking her mother's oral contraceptive pills, the estrogen could stimulate her endometrium, and when she stopped it, what would happen? She'd have a bleed. She says she has not taken any of that. No history of sexual abuse. Of course, trauma could lead to bleeding from the lower genital tract. No headache, visual disturbances. Why is that important? Because you could have a CNS tumor, which stimulates the release of gonadotropin-releasing hormone, FSH, and then produces estrogen. We'll talk about that later. But she has no headache, no visual disturbances. On exam, she is normal for her age. No pubertal changes. The pubertal changes would suggest that there was some estrogen, and she has none of that. Pelvic exam under sedation reveals a vaginal foreign body. And the important take-home from this case is the most common reason for a little girl to have vaginal bleeding is a foreign body. Premenarchal bleeding is bleeding prior to puberty, and there's lots of reasons, but the most common by far is a vaginal foreign body. Yes, you could have a neoplasm, you could have sexual abuse, you could have ovarian, pituitary, adrenal tumor, which we will talk about later, but clearly the most common is a vaginal foreign body. The diagnosis is made by pelvic examination under sedation. And this is important because you don't want to traumatize a young girl. If you find it, take it out. If you do not find anything, then of course you're going to have to do further workup, CT, MRI of the head, the abdomen, the pelvis, and we will talk about that later. Where does early estrogen production come from? This is an actual case that was reported of a 3-year-old girl who had vaginal bleeding, and here you can see what was found in her vagina. Broken pieces of bangle, small wooden sticks, wheat husk, wheat grain. Remember, foreign body. And that's the end of premenarchal vaginal bleeding.